Day and good morning, everybody. Thank you for being here. I would like to recognize all of the organizations who have sent out the notice today. We want to recognize, of course, Public Health for working with GHRA on these testing protocols and also the platform, and also our partnership with AMC. I want to recognize them since we've been working with them since December 2020. It's really a great partnership where we've been able to vaccinate thousands of people here on Guam, as well as continuing to test. And so everything that we'll be presenting today, we're going to be presenting 3 testing options for private sector as well as public sector to consider as these mandates for Executive Order 2021-19 through 2021-20 will be going over. I know that some people are still joining us and we'd like to welcome them. Danielle Areola is from GHRA and she will be monitoring the chat if anybody has any questions. Because this is not a webinar, this is actually a meeting. We'll go ahead and take your questions at the end of the presentation. I did invite Department of Public Health and Social Services to be online at the end, should they be available to answer any questions. But I did meet with them in advance to go over all of the materials. And so you will be able to see this, and all of the handouts will also be loaded on our GHRA website. Danielle will have that in our COVID section under presentations at ghra.org. So all of the materials available today will be uploaded during this meeting, in addition to the presentation, which is available for public use. This is being recorded, so we could also save it onto our YouTube channel. KOAM will be streaming it as well. We did invite the media so that they can share this with a lot of businesses. Because this plan is not just for GHRA members, it's truly for the private sector, and also considering some of the public sector, especially the autonomous agencies who still have to consider what they'll be doing with regards to testing protocols and platforms for their unvaccinated employees. So next up, I would like to just put some housekeeping rules. Again, I'm just going to go through the presentation. If you could reserve your questions towards the end. If you have any questions in between the presentation, we'd appreciate it if you could put in the chat. Danielle will take all of those and we will ask them as we end the presentation and go through all the questions. We will open it up at the end to all of our members and non-members who are joining us today, as well as the and also give everybody the opportunity to ask questions, as well as the media. I'd like to thank the Employers Council, Society of Human Resource Management, the Guam Chamber of Commerce, Guam Women's Chamber of Commerce, as well as the Guam Contractors Association. They did share this out with their members, and we appreciate the continued collaboration to find solutions during this pandemic. So starting off, as promised, we are going to present the different options available for consideration that I have discussed, GHRA has discussed with public health. So here, just before we give you the options, just for those who may or may not know, the different types of tests available are the molecular test, the antigen test, and the antibody test. GHRA and AMC have worked together on both the antibody test as well as the antigen test. Any molecular tests, those tests usually have to be completed at the lab with public health or at their clinics, their stand-up sites, as well as any of the clinics that have been authorized with the different machines for molecular and the PCR testing. So those are available throughout the island. I will go over the different kinds of tests that are going to be available through these different platforms. But this information is from FDA.gov. All of the resources are at the bottom of the page. If you have any questions, I'm not going to go through each slide. We just want to highlight the differences between molecular testing, antigen testing, and antibody testing. For testing for employers, we're only going to be talking about antigen tests and molecular tests. What we discussed with public health is that the public health will maintain their testing sites with the Abbott Binax Now, as well as real-time RT-PCR tests. Those testing sites, on the right-hand side of your screen, you see the flyer for the drive-through clinics through September 11th. They're committed to continue offering testing sites as well as vaccination sites in cooperation also with the National Guard. And so we'll continue to share when those vaccine clinics and testing sites will continue to be available through public health and National Guard. For now, with response to the different EO requirements on testing mandates, they will not be standing up a new testing site. They're working with us on identifying what the needs are. And so we did send out a survey to our members and also made it to the available to the public to find out exactly how many individuals still who are currently employed and in those covered establishments will need to test weekly for surveillance testing. So for now, public health will continue their testing sites at Teason, as well as the community health centers in the north and southern centers for CHC. And then the employers will also have an option. And just so you know, GovGuam has already given some employer sites, public sector employer sites, to have the Abbott Binax Now antigen cards. And that is currently, they've already trained and certified the Airport Authority, the Fire Department, Police Department, Superior Court, Secret Service on the federal side, Department of Corrections, and Guam Behavioral Health and Wellness, I believe is this week. So they are willing to offer this to private sector companies, but there are a couple of requirements that you will need to complete, and I will go over that in the next slide. But it will be available to employers, especially large employers, where you have large volumes, possibly of employees who need to test weekly. But you will only be allowed to have the Abbott Binax Now antigen tests. For the GHRA AMC mass testing site, we will have both the Abbott Binax Now antigen tests, as well as authorization to have the ID Now machines. These are the molecular machines, so the accuracy is much higher than just doing the regular antigen test, and the time is also really efficient. So I did a comparison of the different options available to everybody based on the 3 available sites. So with public health, and of course, these are approximate times, under public health for the Teason and CHC sites, Binax Now, even though it's only a 15-minute test, they are still notifying you within 24 hours. So you still have to understand that, you know, there's a lot of people who go through this and they are notifying within 24 hours. If it's the PCR test where they're doing the swab and it has to go to the lab, the notification is up to 48 hours. And so the testing frequency, it does vary. As you know, this last week, or last couple of weeks, they've been increasing testing daily through the weekdays. And so those testing frequency will vary, but they are committed to continue testing at those sites. For notification, sorry, that's actually incorrect. That is actually a manual notification. They are only notifying you through phone calls or by letting you know. So we will update this on the slide. So the notification is actually manual through a phone call and or through an email. And then cost is, there is no cost because it is free to the public. And the requirements are that you will have to send your employees to each of these sites. And I've heard, you know, a variety of timeframes from an hour to 4 to 5 hours, depending on the traffic and the wait times. So it does vary. I don't want to put a number on it because it varies. And then also just depending on the number of people who will be testing. So imagine if we've had the number of people the last couple of weeks testing, where it's between 600 to over 1,000 people testing. That's, you know, going to vary if it's going to be an hour up to 5 hours. It is based on first come, first served basis. So you will have to line up according to the queue for each of those sites. Under the employer testing site, which is Binax Now, you will, as long as you go through the training and certification, you will be allowed to have the antigen kits, which is only a 15-minute processing time, but you have to follow the protocols. The testing frequency will be up to your employer. The notification will be in person. The cost will be free because the kits are free. And then requirements, which I will go over in the next slide, is that public health will require that you attend training. And then also you have to be medically fit to wear an N95. And so once you're medically fit, you need to fill out a medical questionnaire and have your physician sign it. But then you will also be taught how to do a fit testing. Public health has been certified by 3M. And so they will extend their CLIA waiver in order for you to conduct Binax Now, available at the employer site, but as long as you pass these qualifications and certifications with qualified staff. And it has to be dedicated staff. Not everybody can conduct these tests. It has to be dedicated staff who will be authorized and trained by public health's lab team. You will be subject to inspections. Actually, HHS, they will be here the week of the 20th of this month, and they will be conducting inspections at all of these locations that have a CLIA waiver from public health. So you are subject to inspections, and you are responsible for all records, management records for all of your employees who go through the weekly serial surveillance testing, as well as for the inventory for the test kits that you have. Under the GHRA AMC testing site, we will have two options. And so that's a very critical difference. For the employer testing site, you will only have the antigen test. Now, let's say you have an employee who tests positive on the antigen test. They will have to go to a public health testing site to get a PCR test, or a clinic to get a Abbott ID Now or a PCR test. So they will have to go and make sure that they get an additional test because the antigen test that is just used with the solution has a lower sensitivity rate than the ID Now machine, the molecular machine. So GHRA and AMC is working with public health to ensure that we not only have the Binax Now kits that will have results by within 15 minutes, we will also have the ID Now molecular machine so that we can get results. If you are testing positive, you go to a different section that is secured and well ventilated, and it's actually in an open space that has between 15 to 30-minute notification to verify your positives. So you're not really reading a false positive or possibly an issue with the test. It is verified on the premise, and you will have to follow the same protocols to isolate, as well as contact tracing with your employer and with public health. And so GHRA and AMC will have both Binax Now as well as the ID Now molecular machine. For now, depending on the number of people who need to test weekly, we are looking at possibly one clinic a week or up to two, depending. We need at least 1,000 people per clinic. And just so you know, when we've done these testing clinics and or vaccination clinics, the average time, even though the wait time is only 15 minutes for notification, the wait time is total from pre-registration all the way to the end is about on average 23 minutes. So if you are positive and you have to go to the ID Now, you just add an additional 15-30 minutes, and then you go through with isolation if you are indeed confirmed positive again with the molecular test. So with that in mind, we know that we can test up to 1,000 people within 4 hours. And so we've already had this in place for about 9 months now. And so we've really gotten our protocols down. The notification is very important. If you go to our site, the GHRA AMC site, you will not only get actual notification on site, but you will get digital notification because you will receive a QR code, which will have your history of your tests every week, as well as if you one of your employees eventually gets vaccinated, The program that we've been using with the registration for all of our vaccines and testing sites come with a QR code. And so you will have that history of both tests, whether it's PCR, the molecular or the antigen test, or even the blood work as the serology one, or even the vaccination, if indeed they get vaccine at some point. There is a cost. It's $25 if you send employees to our testing site, because there are costs associated with the administration of these tests, to cover the labor costs, all of the registration, the electronic digital platform. So all of that included is an admin fee of $25. If you look online with Walgreens, CVS, the kits are with shipping fees $27. There are clinics on Guam that charge between $50 to $60 if you go to the clinic to get the same test. So we are very grateful to AMC for offering this price, as long as we get the volume at $25, because it's part of our community effort. The test itself, though, from public health is free. This is, again, an administrative fee. So the requirement is also employee travel, similar to public health's TDSIN and CHC Center, but we will be at a central location in Tamuning, Tumon area. And we've identified a couple of sites. We just need to know exactly how many people will be testing every week, and we will announce where those testing sites are. I will be meeting with public health to wrap up from our meeting today and give them some feedback on exactly what we plan on doing, but we're going to need your help to either update the survey that you all completed the last 2 weeks. And what we've done is we also added some sections where, if in case you answered, our range really for the survey is between some businesses are fully vaccinated, as low as maybe 50-some%, and as high as actually 98%. So we just need to know, if you're 98%, what does that mean? Is it 2 employees, 10 employees, 30 employees? And then the same with those who are still in the 50-60% range. We need to know, is that because you're a small employer and maybe you only have 5 employees who have yet to be vaccinated, or are you a large employer and maybe that's only 10 or 50? It depends. So Danielle is putting out on the chat all of the links, again, to our GHRA website, where all of the materials on this presentation from today's meeting will be uploaded, but also the link to the survey, because even if you answered it, we had 136 companies answer our survey. We've updated it to include more information that public health needs. And please know, we're not sharing individual information. We're only sharing aggregate information to public health. But we do need everybody to fill out the survey, update it if you've already completed it. If you haven't, please complete it so that we could recognize you. So the GHRA AMC testing site will also have online registration, which I'm going to be going over in a little bit. So with regards to the actual tests, these are what the boxes look like. There are some disclaimers I have with regards to the antigen cards. These are the boxes that come in from Abbott Laboratories, and the difference between the Binax Now kits versus the real-time PCR test. And this link is to the cdc.gov website, where it shows the comparison. The sensitivity, if they are asymptomatic, it really only shows it at 35.8%. But if they are symptomatic, the sensitivity is 64% as compared to a PCR test. So it's still really good to be using. It's really designed for serial testing for symptomatic individuals. But because of the mandate, which goes in effect on September 27th, 2021 of this month, we will need to use these tests on both symptomatic as well as asymptomatic, but mostly asymptomatic, because we need to do surveillance testing for employees who are currently unvaccinated. Something to note, public health did state that for those who are unvaccinated, Whether or not they have medical exemptions, they will need to test regularly, as long as they remain unvaccinated. The exemption process has not started yet. The exemption letter and form is still with the Attorney General's office from Public Health. And so please continue to email Public Health. And if anything, at least print out a copy of the email request to Public Health that you did notify them if your employees have a medical or religious reason. Now, if they don't have it and they still want to remain unvaccinated, Public Health understands that some people still haven't processed exemptions. Either way, regardless, they still are requiring regular testing for anyone who is unvaccinated. So another clarification is if somebody previously had COVID, they are going to put in the guidance that they should not test regularly because it will still pop positive, the test. So if they are previously COVID positive and unvaccinated, they won't have to test within 90 days unless they become symptomatic. So that's a very clear distinction on what we need, on guidelines we need to have, protocols for the employees who are unvaccinated. And these, again, are only for employees. We have not been asked to test for unvaccinated patrons at this time because they are only allowed for takeout. And everybody understands, that this is what has come through on the mandates. And of course, GHRA has been very vocal about this on our position with regards to these mandates. But regardless, as an organization, our role is to provide resources and information, and also to provide the training and the necessary tools and additional resources for our employees, and especially our HR managers, directors, and safety and security and health professionals who need to really implement a plan. And so that's really our role today, is to organize all of this with the government, advocate on behalf of the industry, and to find solutions so that we can accomplish these tasks during this pandemic. And so the sensitivity for asymptomatic and symptomatic, again, are there. Specificity is higher, again, for symptomatic, and asymptomatic is at 78%. So it's still a really good surveillance test, knowing that 78.6% of the time, it will still be specific whether or not that person has COVID. And then if somebody is symptomatic, and let's say they are masking symptoms, possibly with medication or whatever, for that timing, it will still be sensitive, specific enough that possibility of showing positive for COVID. And that's why they will be redirected. If they show positive on the antigen test, they'll be redirected to the ID Now molecular test to confirm if they are indeed positive. And again, that's only at the GHRA AMC site. If you are at an employer-sponsored site working with GHRA and Public Health, you will have to send them to Public Health to get an additional PCR test to confirm they're positive, or just have them isolate. And then you can start the contact tracing process. The purpose of all of this, again, is to facilitate this on behalf of the industry, but really to facilitate for earlier isolation. The challenges of going to, the public health sites is really there is a 24 to 48 hour notification. And we really pushed, if you're going to mandate the industry for covered establishments to have to have mandate testing for unvaccinated employees, then we really need a faster, more efficient, results-driven test where we can facilitate earlier isolation and begin contact tracing. And so we strongly feel that these options for both employers as well as our mass testing site with AMC will help really complement public health and assist in this process during our community outreach to get to fulfill the mandates. And then also, again, the surveillance. This will serve as a surveillance tool so we could weekly test everybody who's unvaccinated. And the weekly testing is important, because that's why these tests were created, is to create surveillance so that you can show as a community, even though you have unvaccinated individuals, you're regularly testing them and surveilling them every week to ensure that there aren't people who are going to work who possibly could be positive with this. Now, next slide is, it's actually a video. This is a video of what's available on YouTube. It shows how the self-test kit is administered. This is what Saipan is doing, by the way. Other places like San Francisco at the airport, a lot of places are doing this. But this is really administered by medical professionals, and they're really observing you, and they're maintaining all the health and safety protocols are in place, although it's a self-test. Now, in lieu of an administration or a medical professional, the employers will be allowed to go through the training with public health, and public health will extend their CLIA certification, but only if you agree to all of the requirements. Now, if not, then this is the exact same self-test that will be administered at TDN, CHC, or the GHRA AMC test site. I'm gonna play the video. Please know that this video was created for home kits. So I have a disclaimer there on the right-hand side. Home kits are actually not authorized at this time by public health. At some point, if they authorize home kits, that's really up to them. But right now, the antigen test kits that we have are not meant to be home kits. Even though if you buy them at a pharmacy or you order them from off island, please know that those will not be accepted at this time unless public health weighs in on that. But the home kits won't be allowed because somebody has to monitor and ensure that your results are really done in front with that employee there, and the results are recorded that same time period that it's conducted.
Our trusted, easy-to-use 15-minute COVID-19 test can now be used in your own home, on your own time, without a prescription. The BinaxNOW COVID-19 antigen self-test is conveniently available over the counter at a retailer near you. This video will show you how to use the BinaxNOW COVID-19 antigen self-test. Before starting the test, carefully read the full instructions that are in the box. The box includes 2 tests for repeat testing. Simply test yourself twice within 3 days, at least 36 hours between tests. By testing more frequently, you may detect COVID-19 more quickly and reduce the spread of infection to others. In the box, you'll find 2 test cards, 2 dropper bottles, 2 swabs, an instruction sheet, and a COVID-19 fact sheet. You will also need a timer, which is not included with the test. Gloves are also recommended during test, but are not included. First, prepare for the test. Wash or sanitize your hands. Make sure they are dry before starting. Take 1 test card, 1 dropper bottle, 1 swab, and your timer. Remove the test card from the pouch and lay it flat on a table for the entire test. Keep testing kit and kit components out of the reach of children and pets before, during, and after use. Make sure there is a blue line showing in the result window. If you don't see a blue line in the control position before starting the test, do not use the test card and contact technical support. Open the test card so it lies flat on your table. Do not touch the test strip. Remove the dropper bottle cap. Hold the dropper bottle straight over the top hole, not at an angle. Slowly put 6 drops into the top hole. Do not touch the card with the bottle tip. Now, collect your nasal sample. Open the swab package at the stick end and remove the swab. Be sure to keep your fingers away from the swab end. Swab both nostrils carefully. Insert the entire soft tip of the swab into one nostril, usually 1/2 to 3/4 of an inch. You do not need to go deeper. Using medium pressure, Rub the swab against all of the inside walls of your nostril. Make 5 big circles for about 15 seconds. Using the same swab, repeat the swabbing in your other nostril. Next, perform the test. Keep the card flat on the table. Insert the swab tip into the bottom hole. Firmly push the swab tip from the bottom hole until it is visible in the top hole. Do not remove the swab from the card. Turn swab to the right, clockwise, 3 times to mix the swab with the drops. Do not skip this step. Leave the swab in the card for the remainder of the test. Peel the adhesive tape liner off of the right edge of the card. Be careful not to touch other parts of card. Close the left side of the card over the swab. Press firmly on the 2 lines on the right edge of the card to seal it. Keep the card face up on your table. Wait 15 minutes. Do not move or touch the card during this time. After 15 minutes, check your result. It is important to not read the result before 15 minutes. Results should not be read after 30 minutes. Next, check your result. To check for a positive result, look at the result window carefully for 2 pink or purple lines. Make sure you look closely at the bottom half of the results window, where it says sample. Even a faint line next to sample is a positive result. A negative result will have only 1 pink or purple line on the top half of the results window, where it says control. This means that COVID-19 was not detected. But if you see any of these results, the test is invalid. An invalid result means this test was unable to determine whether you have COVID-19 or not. A new test is needed to get a valid result. If you see an invalid result, please contact technical support at 833-637-1594. Throw away all used test parts in the trash. Please share your test result with your healthcare provider. You should take a second test within 3 days, with at least 36 hours between tests. Together with vaccines, the Binax Now Self-Test can help people get back to doing what they want and need to do, like going to work and school or seeing friends and family, with greater confidence.
So as stated earlier, these individual kits, if you ordered them online or through a pharmacy, they're still helpful to use them, even for families, right? So for example, like I have a grandmother, we all help watch, we have shifts where we watch my grandmother. And so a lot of us could order these just to make sure that we regularly test at home. But for employment, it is required that you go through the public health test sites, because you're still subject to recording the results. And so the kits that we have available on Guam through public health are not meant as home kits. And so they will be distributed only to companies that have gone through the training and certification, and then also to GHRA and AMC. We've had an authorization letter for the Binax antigen cards since the beginning of this year. And so GHRA and AMC have been putting these test kits out for a long time now. And it's also very important to note that if you are, as an employer, are wanting to administer this on your own, you need to, again, be able to identify staff who can qualify to pass a fit test for the respirator using an N95 mask. You also need to make sure that you're able to attend a 2-hour training session that includes a biosafety best practices course, and also the Binax Now antigen testing to go over these protocols of exactly what was demonstrated on the video. Now, the only difference is you won't be retesting in 3 days, you'll be testing every week. And so again, you'll have to maintain inventory as well as records management and subject to inspections should you choose to do this on your own. And Danielle updated the survey, so to give you options, if you are interested in only sending your employees to TDSN or CHC, we'd like to know that. If you're going to be signing up as an employer who's interested in administering this on your own, in cooperation with GHRA and Public Health, then let us know that as well. And then also, if you are interested in just working with GHRA and AMC on the mass testing side and just sending your employees to that location and paying the $25 per test per week, knowing that all of that is covered. And then you also have digital registration and then electronic copies of your records, which the employer can also have access to, as well as public health, which helps with contact tracing. So those are really important. I'm going to play the next video. So the difference here is, again, this Abbott ID Now machine is only available through loan from Public Health, and this will be at the GHRA ANC testing site. I believe they also have it at other places, including clinics, but you will be able to immediately be able to run your results should somebody test positive with the regular antigen card. On the self-test and the self-swab, then they'll be able to go immediately to the other room and get a verification whether or not that result is also positive using the molecular machine. So this is really important because then you don't have to go to a second location to get additional testing, as well as, so it cuts down on time. It's all at the same location, and it's a lot more efficient, and there's immediate notification on the site, as well as you will get notified on the different parameters that you set up for, whether it's SMS, text, email, and then also you will get your notification on your QR code, which will show all of your testing dates, the history of it, as well as, again, should that person decide to get vaccinated, they can also get their vaccination date. And so it'll be a proof of vaccine and or proof of test. Next up is the, apologize, for the employer site testing protocols. So Danielle has also updated the website to include the documents that I'm sharing here today. As an employer, you need to fill out the survey and let us know. There's also a letter of intent. If you are interested, please submit that to GHRA at info@ghra.org, so that way we're managing it. So the letter of intent has to be completed. And then again, the CLIA waiver. A CLIA waiver is required for public in order to administer these tests or even vaccinations off-site for emergency use. And so Public Health doesn't have a limitation on their CLIA waiver, but they are required for overseeing you as a company, as an organization, if you're going to take on that responsibility to test on site. But you will be limited to just the Binax Now antigen test. So the CLIA waiver does come from Public Health. With that, you have to, again, take 2 hours with qualified staff who qualify to be able to pass a fit testing, to wear a respirator N95, as well as additional PPE, personal protective equipment items that are required with conducting these tests. Even though it is a self-test, the people monitoring, administering, and recording need to also don PPE, the appropriate PPE, and they all need to take that training. And also you need backup if in case you have different shifts, however, how many employees you're going to make, you're going to include to be qualified to administer this on behalf of your company. So for the administration, for records management, again, inventory management, and then you're subject to inspections as well. These are the additional forms. This is the guideline that goes along with the training. And of course, they have more information at the training center. GHRA has already secured training dates for businesses who are interested in this. I've already heard from autonomous agencies for the government, not line agencies, but autonomous agencies, that they may want to join this one, as well as possibly a large employer. So if you are interested, please let us know. I have already secured training dates for September 20th and 21st, which is 1 week before the implementation date of this mandate on September 27th. And so those dates are very important. So you have to notify us if you're interested in this and fill out the proper documentation. But those training dates with public health are September 20th and 21st. On the right-hand side is a sample of the OSHA respiratory medical evaluation form that does need a physician to sign off to make sure that they truly are fit to wear a respirator, specifically according to the job duties as required by this. And then they also have people who have been certified by 3M to do the fit testing. And that will all be conducted in the 2-hour training session. Under the GHRA AMC testing protocols, we will have online registration. It's the same one that we've been using for vaccinations. We will have a registration site. Right now, it's guamcovid.com. So you could see that at the top underneath the header. It's guamcovid.com. You can sign up for tests, PCR tests, or even now Binax antigen. We need to update that to include the ID Now molecular test, as well as even sign up for vaccinations at any of the outreach clinics that AMC has. And then also on that same site, you will be able to also register for your QR code. So online registration is available on the website. And then you'll also be able to schedule your weekly appointments, whether it's at our mass testing site, or let's say you even want to just go inside to the clinic. If you want to do that, that would be subject to something else. But really, for this protocol, for the regular surveillance testing, it will be limited to that one site because we need to drive the volume in order to support the administrative costs on running a mass testing clinic. Also, AMC has their own CLIA waiver that they would take out, that they have at their clinic, and they would extend it out to the site. That's what we've been doing throughout the year. And then the process is, because you've already registered online, you're pre-registered, so therefore you walk in, you check in, which takes only a couple of minutes. Sometimes only, we've timed it where it's only like even no more than 90 seconds to 2 minutes on pre-registration, up to 5 minutes, depending if you actually been registered and all your information is up to date. If not, then we do take walk-ins, but you're going to be put on a scheduled time. For sample collection, that happens right after registration. Your sample will be collected and all of the proper protocols will be followed. We have the plexiglass, we have all of the equipment, the PPE for the staff. But again, this is going to be a self-test. So you as the employee or your employees will be on the opposite side of the plexiglass. They will be given instructions to do the self-swab as demonstrated earlier on the video. And then the medical staff will receive your sample and then turn it into the table where they have the result determination. This is very important, whether you're employer sponsored or through AMC. The timing is extremely critical of this. So the timer for each test, you cannot go past a certain time because then it'll null the entire test. It'll be void if you go too long because it resets itself. So the documentation on this is extremely important, as well as when you write in the time. And so that's why AMC, they have so many staff that come out for each of these vaccine or testing clinics, because there's a lot of labor involved to ensure the integrity is followed for all of our health and safety protocols. Then the last piece is you will be directed to go towards a waiting area. And then of course your test result will be given with your notification, and then you'll be given that in person. And then you'll also be able to receive it once you register for your QR code. So you can have a record of it, and you can take that and show your employer every time you re-enter to work that week until you have to test again the following week. This is a mock-up of what our vaccine clinic and testing protocols would look like at the Hyatt. That is where we've been doing a lot of our outreach clinics. You know, AMC has also been to Hilton, the Sabaki Tower. They've done it also like at Ukadu. They've done it at schools, community health centers. They've worked with mayors. So they've been out and doing outreach clinics all year long. This sample mock-up is specifically to the Hyatt. Something to note again is there is a separation of the room if in case somebody does show positive on the antigen test for the self-test, self-swab, they will have to go to the next room where we will have a separate testing area for the ID Now machine, the molecular machine. And that will be an additional time, processing time and notification. And so that's something different we will have to set up for this. So again, this example is just the Hyatt example. And so please know it's subject to change. For proof of testing vaccinations, this only applies to if you go to the GHRA AMC clinic, offsite clinic at a secured location. You will be able to get your QR code, your test results, and you will be able to download it either on Android or Apple using the iOS system with a mobile application. Our plan is to use the GHRA app that we do have. So you can download the GHRA app. And then on the back end, we're working with MD CareClick out of California, who has been our vendor for throughout this year, where we use the Epi connector to register everybody for their vaccines and or tests. And then you will be able to register online on the web or also, and then receive your information through the app. It is a paperless secured option. It's secured because you don't have to carry around your paper. You don't have to show any other identifiers like your date of birth or anything like that. Here is a sample of my QR code on the right-hand side. This is our former version. It's been updated since then to include the new layout, but I wanted to share with you what the QR code would look like with obviously I'm vaccinated, so it has my vaccine dates. Now, if I were a person who's unvaccinated, then it'll show my PCR test dates. If you want to go to your history, you go to the web, you go to the website and you can log in and look that up. But your QR code would have the most recent test to show the last 7 days when you were last tested. For your vaccination, if this is for the vaccination, it is verifiable through WebIZ, where we are working with public health on making that available. You'll have sharing options. Let's say you have to report to your employer. When you report it to your employer, it doesn't have all your personal ID. So it still just has your basic information. And then you can sign up for notification and cancellations of appointments. Let's say you missed the time slot for 2 p.m. and you need to sign up for 3:30 because you got off work late, or let's say you didn't make it on time. So you can actually sign up for notification and cancellation on your appointments. Everything is digital. And then you'll also get automated confirmation and reminders through SMS as well as emails. We have called individuals. We have a project management team where they actually do outbound calls to individuals who are late to their appointments. And we want to verify if they're still coming, showing up, because otherwise we'll allow the walk-in individuals, people who came in last minute, to start entering. And this is really important in order for us to get everybody in and out within the average of 23 minutes. So SMS, emails, calls, you will be able to look at your appointments, as well as it'll be a reminder if in case your booster is coming up, if you're eligible for that, or let's say your renewal on a test. benefits of the QR code of what makes it different. If you go to the GHRA AMC testing site, of course, is in order to meet the mandate for the proof of vaccination, instead of working with paper cards, we are able to show a digital code which goes away and it doesn't stay with that business or establishment. You can show proof of vaccination as well as tests. It is a digital record that's secure and private. It complements public health because all the data is actually reportable to public health. They do receive it. We can verify it with WebIZ, and it's also HIPAA compliant. There's an authentication process in the back end where we verify it with WebIZ if in case you are vaccinated. There's an authentication process on our end with the clinic. If you're getting your PCR tests, it's the clinic. Our registration team is actually verifying it there and authenticating it. And then it's standard so that the private sector across the board, it's a standard way of accepting employees into the workplace, having test results regular, and rather than manual forms each time. And then the last slide I have is that for public health, they will have an admin portal option as well as an employer portal. And so they can look at the site management system where they have secured access. For employers, if you sign up for this, you will only be able to see the number of people who have been assigned a QR code. And what their test results are, if in case you are sending them, if in case you have anyone who's test positive, you can use this for contact tracing to start that process with public health. So public health can also use this to look at contact tracing, not only from the employer standpoint, but also on the vendors. So let's say if anybody tests positive, this is in the future, short-term future, if public health accepts this to use island-wide, they can also look up vendor information. So let's say I had a birthday dinner with a gathering of only 10 right now at a particular restaurant, but somebody in my group tested positive. So therefore they know all my contact tracing dates. They can look at the date and time when I entered. So then they can look at the other people who scanned their QR code at that same date and time. Otherwise, the process right now is those establishments, they rely on the manual logs. And so it's all paper. So we're hoping that public health adopts this, and so they go digital, and they can look at this real time too with their admin portal, and the same with HR. So you could look up vendor information as well as individual information. And of course, records management is on vaccinations as well as tests. QR code for entry, not necessarily your documents, but you can upload your vaccine card, by the way, if you need a secondary verification, or even your letter from public health or one of the clinics where you got your vaccine. Or let's say you went off island or you were in Korea and you got your vaccine in Korea. You can upload any official documents. It takes all images. So you can upload any image to serve as your secondary verification or even third verification. And then public health can also print out reports from this program. Again, as a reminder, so I'm closing out, the public health testing site is at Tiedzin and CHC. They have the Binax Now, which right now their notification is within 24 hours. PCR is within 48. Testing frequency right now, they have it during the weekdays. Notification is manual, right? Because they're calling the people, not digital. We will correct that. The cost is free. Again, requirements is that employees will have to travel to Tiedzin and CHC. It is first come, first serve. So you have to queue in the line upon when you first arrived. And then for employer testing site, I already went through all the requirements and the forms. That is up to the employer how often they will be testing. If they're going to be testing daily for different people who come in for different work schedules or once a week, that's up to the employer if they are approved. Notification is in person. They won't have any digital records of this. They'll have to provide photocopies, not unless an employer is set up with a intranet with some kind of portal for your employees for communication. And then the last piece is, again, for GHRA AMC testing side, we've been able to take the best practices that we have from our vaccine clinics and our other testing sites And we've been able to share this with public health, where we will be able to have FINEX now for antigen testing, and then the molecular testing using the ID Now machines that will add on time, but that's only for people who test positive on the antigen cards. Testing frequency, depending on volume, would be 1 time, possibly up to 2 times a week at a central location within Tamuning or Tumon area. Notification, or it's multiple, it's in person, it's also digital, and it creates your history. So if in case you ever have somebody questions it, you have your history of all your tests, as well as if in case they do get vaccinated. The cost for this is $25. Other clinics, if you go to a clinic, if you go to other clinics, it's between $50 to $60 at those clinics. Because we're working with AMC on a mass testing site, they've been able to lower their cost. And since the test kit is free, to $25 per person per week. But that comes with the digital platform, with the online registration, and it reduces your employee time, because also the secondary test, should they test positive, is right on site in a secured room. So with that, I'd like to open it up for any questions. I do have one question so far. Do employers have to pay the time spent for employees to get tested? That is really up to each employer. We actually, I will have Danielle upload on the chat another document where we worked with the Society of Human Resource Management, and Attorney Vince Camacho actually provided clarification on this. So if you are going to have to pay their time in order to go get tested, we have the legal advice from Attorney Vince Camacho. So we will update that as well. The other question is, please repeat how to handle employees who are unvaccinated and have had COVID. Public Health said, right now they don't have a guideline for it, but Public Health did tell me yesterday that as long as an employee is still unvaccinated, but if they tested positive for COVID, you don't have to do serial testing for 90 days because they're going to show that they're positive. So they will be exempt for it for 90 days only from the time that they tested positive. So that has to be documented if you're going to waive them from getting the test. But Public Health is planning, they are working on guidance right now for this because this is going to be effective for government employees, public sector, line agencies, effective September 24th, and for private sector on the covered establishments, effective September 27th. So please hold out for that. Right now, this is just what they gave me yesterday to provide clarification on this. So right now, they won't need to test weekly because otherwise they may continue to show that they're positive within those 90 days. So you will have to document that and ensure that that employee understands that once 90 days is over, their antibodies are cleared up, and so they'll have to start testing as long as they remain unvaccinated. But they still are always, the option to get vaccinated is still always available as well. I'd like to open it up for any questions. I do have additional questions, but I wanted to hear from the group that's actually here. We have 81 participants here today, so thank you everybody for joining us. You can unmute yourself if you have any questions.
Hi, Mary.
Yes.
Hey, I actually sent the question to Danielle directly, but I just wanted to make sure it went through. I guess it didn't pass on to you, but anyway, thank you for today.
Questions here, Jude. I have like 4 pages of questions. I just wanted to open it up to anybody if they want to ask. So if you want to ask your question, I can just mark it off the sheet.
Oh, great, thanks. Yeah, so just to clarify again, employers of covered establishments will have an option to test their own employees weekly, or is it mandatory?
No, you will have the option of You won't have the option of whether or not you test weekly. Every covered establishment required under the mandate of Executive Order 2021-19 through 2021-21, for those covered establishments are required to test weekly all unvaccinated employees.
Yes.
Unless they were previously positive for COVID, then they get a waiver of 90 days, but you have to document that. So the one that's an option is whether or not you send your employees to either of these 3 locations. And I'll bring that up on the screen again. You have options of where you can send your employees. So either to the public health testing site at Teason or the community health centers, both north and south. Unless they open up another testing center, employers have the option of bringing it in-house if you have so many that you need to test and you are interested in getting certified to do this. You will only receive the BinaxNOW antigen kits, self-test kits, but you'll be responsible for everything that I outlined in today's presentation. Otherwise, you can send your employees to the GHRA AMC testing site in Tumon. Those are the only ones that are options. It is still mandatory to test your employees weekly if they are unvaccinated, unless they tested positive for COVID.
Yeah,
only up to 90 days.
Yeah, that part's very clear about. I should have specified the question was more towards those that choose not to be vaccinated or have no exemption or the 90
so
days.
they all have to test, regardless if they
Okay.
have an exemption or not. And it's really hard to say they have an exemption yet because public health has not given exemption letters to anybody because that letter is still at the AG's office.
Yeah, AG's office.
Right. So right now, everybody who's unvaccinated has to be tested, whether they're exempted or not.
Okay. Thank you. So my next one is just again to clarify, if an employer does do a testing with an employee and test positive, you were saying that they will have to get tested again with PCR or ID now. And this retest is a requirement should they test positive from the employer's BinaxNOW?
If they test positive?
Mm-hmm. If an employer chooses to do the weekly testing for those that are not vaccinated and so on and so forth, and that employee tests positive from our BinaxNOW, just to clarify, you're saying that that positive employee will have to get retested again with public health or with your site. That's a requirement. Okay.
Using the molecular or the PCR test.
Yeah, the molecular. Okay, just wanted to double check that.
Yeah, so it's an additional step because employers who are under the CLIA waiver for public health doing this on their own will only get the antigen self swab kits.
Okay, I'm good. Thank you.
Okay, thank you. I also have representatives from AMC. I have Flo and Dr. Wen, as well as we invited public health for the Q&A portion. I'm not sure, I'll ask Danielle if they're online yet, but I know Dr. Wen joined us as well as Flo. So if you guys want to chime in and answer any of the questions, that would be greatly appreciated too. Disclaimer also, I'm not a medical professional. I've only worked with AMC and public health this last year. And so everything that I'm sharing has been through, shared information with authorization from public health as well as AMC. So any questions I can't answer today, we will bring back to public health in our meeting tomorrow. And then I'm meeting with AMC tomorrow at 12 as well. So we will certainly make sure we get all questions answered. One of the other questions I got was regarding September 6th enforcement date for patrons of dine-in establishment. How does this apply to an employee cafeteria? So this is really important. That's why we invited the Guam Contractors Association. Any business that operates an employee dining area or cafeteria where food is served, so essentially food, it's a congregate setting, are subject to requiring only vaccinated people are dining in. If you have employees going to these employee establishments, cafeterias, if they are unvaccinated, they have to take their food to go. They cannot dine in. They have to be fully vaccinated. And that clarification came from Tom Nadeau. So he wanted to make sure that we clearly state this. So although your requirements for people who are unvaccinated and testing regularly are for covered establishments like restaurants, bars, swimming pools, cruises, fitness centers. If you have employees like a hotel or a construction company that you have employee kitchens or cafeterias, then anyone who is currently unvaccinated will have to take their food to go. Or if they're gonna, they will have to, and also they will have to test weekly. So that's something also very different and will be added to the guidelines. Does the employer have to require unvaccinated employees to test weekly between September 6th and September 26th before the effective date is September 27th? No. Right now, the only thing in effect for September 6th is the self-attestation or the verification of proof of vaccine. The testing requirement for unvaccinated individuals for covered establishments or employee dining areas takes effect September 7th for private sector and September 24th for public sector for line agencies in the executive branch. Anyone else in the group that has a question? Otherwise, I'll continue to go on.
Hi, Mary. I have a question regarding the waiver. I know you mentioned earlier something about the waiver still being at the AG's office and not yet released. But what does this waiver actually covers? Does this cover like like medical conditions, like what if you're pregnant and all the other stuff?
Yeah, so originally, right, it was just everybody, it only speaks to for medical reasons or religious reasons. And so the form was actually sent to the AG's office, but it got kicked back to public health because some areas didn't qualify. And so I don't want to speak to those just yet because I don't want to give information that isn't validated yet or verified by the AG's office. But there are some situations that, although they're for medical reasons, do not qualify for medical reasons because there's medical proof that they can still get the vaccine. So that exemption list is not out yet for public consumption or public use. Once it is out, we will share that once public health releases it after the AG's office approves it. The only exemption that they have official that's a form or letter is the one for the quarantine facility. So they've been working on the exemption letter for medical or religious reasons to not get vaccinated. And so that's not done yet. So you need to just assume that anyone who's vaccinated needs to test weekly until exemption letters are authorized.
Got it. Thank you.
Okay, thank you. One of the questions is to clarify, employers of covered establishments will have an option. Oh, sorry, that was Ellie, or that was Jude's question. I understand the employer testing is for unvaccinated employees only. Can we also use Binax now for employee who's exhibiting symptoms or exposed to a positive, regardless if they're vaccinated or not? I would have to defer that to Anne-Marie from the lab because your inventory is truly for the unvaccinated individuals. If you have employees who are vaccinated, there's already protocols that CHIMA has provided to us, and we share that in our HR and education chat, as well as WhatsApp chat, as well as our food and beverage and hotel aid chat, as well as safety, security, and housekeeping. So we'll send that out as well. if they are vaccinated employees, there are protocols that public health is following, as well as there are CDC protocols, and they don't match exactly. So I'd rather refer to Chima's response. I'll have Danielle put that answer out on the chat. It's a long response, and it actually cites the CDC and also public health site on where these clarifications are. So basically, just to kind of be a little bit more clear, for those who are vaccinated and exhibiting symptoms, you should probably not use these tests because these tests are for unvaccinated employees only. So you should send them and have them go get their tests and then isolate. For employees who are unvaccinated, whether or not they're exhibiting symptoms or they're asymptomatic, you should be using the Binax Now antigen test for unvaccinated employees. That is the purpose of these tests for surveillance testing. Okay, but I will find out from Anne Marie and from Chima if the symptomatic would also be allowed, which I would think that it would, but I just need to make sure that that would be allowable in this instance. So it sounds reasonable to expect, right? Since you already have it there and you just send the employee down. But honestly, if they're exhibiting symptoms, they should not be going to the mass testing clinic, right? They should be going through one of the drive-throughs or just isolate at home or go to a clinic. So those are safer options. Where they're not coming out to community testing. So I'll have to get more guidance from public health on this. An employee tests positive and is cleared after 10 days of isolation. 2 weeks later, they're notified of again another close contact of a positive. Since they tested positive before and they retest, it'll likely to show positive. So what's the recommendation of the quarantine period? So that was in the presentation. It's actually 90 days from the time that they were positive. So you have to go back 90 days from then. It does state here that CDC recommends retesting and isolate for another 7 days with no symptoms. And so, yes, I understand CDC is recommending that, but also public health, again, has also their interpretation. So we always have to go with both what CDC and public health states. So that'll be in the guidance according to what Chima sent out. But if anybody is showing symptoms, it's always important to go get tested right away and not wait for this mass testing site or your employer's site. Public health has many outreach clinics, and then the clinics themselves also have testing sites. So if you're exhibiting symptoms or you came into close contact, please go out, encourage your employees to go get tested right away if they are asymptomatic. This is really meant for serial testing every week. Okay, so we don't want symptomatic people coming to our mass testing site centers or even going to work that day and just getting verification from you. Because if they pop positive on that, they're going to have to go get a second verification anyway. So it's probably best that they not have any possible exposures, continued exposures by going to work or to the mass testing center, and they should just go to a clinic and or a testing site with public health. There's a clarification here that I'm hearing different from public health, that they say if no symptoms and they are vaccinated, that quarantine is not required. Please advise which is true. So this is true in that public health has been telling people who are vaccinated, if they came into close contact, that they can just go back to work if they're not exhibiting symptoms. CDC does state that you should isolate anyway. And this is where the employer can actually implement additional rules, right? So let's say if you don't want them to, let's say public health told them because you're not exhibiting symptoms, you can still go to work because you're vaccinated. And if you don't get tested, then you're fine. But if you get tested, once you're positive, you do have to isolate. But it's just safer if they are exhibiting symptoms to go get tested regardless. And if they are positive, then they should isolate regardless. So it's always safer to prevent any further transmission or possible transmission if they're exhibiting symptoms. And so that really should be an HR manager or director's call together with the general manager. And that should be up to each employer, because what CDC and what public health states is a slight variation. And so it is true that they are telling people, if you're not exhibiting symptoms and you've been fully vaccinated, you can still report to work until you test positive, and then you have to isolate. There's another question. It says, do all the testing agencies that are signed up to offer weekly testing offering this to all individuals, or is it strictly for their staff only? So the line agencies that I mentioned, that is only for their staff. It is not meant to be a public outreach. They are only required to serial test their staff. And again, those agencies are Airport Authority, the Fire Department, the Guam Police Department, Superior Court, federal agency being Secret Service, Department of Correction, and Guam Behavioral Health and Wellness. GHRA again is signed up for the training for September 20th and 21st. You need to let us know if you're interested. Otherwise, we still need to know if you're interested in sending your employees to the GHRA AMC testing site. As far as any other questions, does anybody else have any questions that are here, whether it's members, non-members,